It's time now for a weekly check-in with Dr. Isaac Bogoch, infectious diseases specialist. Dr. Bogoch, great to see you. Thank you so much for joining us once again. You wrote on X that, flu season pretty much winded down beginning of this month. What stands out to you about the season that we have had? Does it give us any indication to help us kind of fight it better next season?
Yeah, great point. I mean, we had a very challenging flu season, especially in December, where we had a rapid rise in cases and, of course, corresponding hospitalizations associated with that and urgent care visits. But just around the time of the new year, we started to see cases plummet. They're continuing to plummet. And I think flu season, it's not over, but it's really winding down significantly. It still takes a bit of time before all the numbers are crunched and all the numbers are processed to see how this season fares compared to other seasons. But we know that the vaccine, while still having some effectiveness, wasn't as effective as we would have wanted it to be. And that was a significant contributor to this really nasty flu season that we're working our way out of.
Yeah, and you also mentioned that, COVID-19, the numbers look pretty stable now. But should we expect that to kind of rise as spring approaches? And should people be preparing for that now by getting vaccinated, especially those who are most vulnerable?
Yeah, I mean, we will likely see more COVID. We know it ebbs and flows at various times of the year. And I don't think anyone would bat an eye if we saw a rise in COVID cases over the course of the spring as flu season and RSV season winds down. We've seen that in years past, and we'll probably continue to see it in the future. Like anything else, there are times of year where people should be vaccinated for this, and certain people who should be vaccinated for this. And the guidelines really suggest that elderly individuals, people with underlying medical conditions, should be vaccinated for COVID-19. When the vaccine rollout was in the fall. Now, there's a small subset of people that may need vaccine more regularly. These are very, very severely immunocompromised individuals. Like anything else, it's extremely important to chat with a healthcare provider to see if this is the right approach. There will be a small subset of people who may need more frequent vaccinations because their immune systems just don't function as well as they used to function because of an underlying health condition.
Okay, Dr. Bogoch, I want to switch gears now and talk about antibiotics. We did discuss the dangers of how, overuse of antibiotics can make the bacteria more resistant over time. But I also want to bring in the gut health connection, because there's a lot of kind of medical talk out there about how important gut health is. So do you think that with the use of antibiotics, if people use them too much, it's really coming to a detriment of their gut health, and that could lead to a whole plethora of other health issues that we might not know about or experience?
Short answer, yes. Slightly more nuanced answer. We don't want to overuse antibiotics for multiple reasons. Number one, it's a precious resource, and if we use them inappropriately, as you point out, the bacteria become resistant and this precious resource doesn't work anymore. And of course, now we're seeing very significant global ramifications of that, with up to 4 million deaths per year because the drugs that we rely on so heavily don't work as well as they used to. But of course, there's individual health issues as well. And as you point out, gut health is one of them. Now, let's not pretend we know everything about this. I think this is a field that's still in its infancy. And I think we have to be very humble about it. But let's also appreciate that these antibiotics they're not selective. They don't just take out the bad bacteria. They wipe the floor with many bacteria, including good bacteria, not just in our gut, but there's good bacteria elsewhere in and on our bodies. And we're, for lack of a better word, nuking them with antibiotics. Now, of course, if you're sick with a bacterial infection, you need an antibiotic. You got to kill that infection. But it does sometimes take out good bacteria as well. And that's why sometimes doctors say, hey, listen, during or after a course of antibiotics, you can take a few products like, some people take probiotics when they're giving an antibiotic. Other people just simply ingest yogurt because that's, it's cheap. It does the exact same thing, and it can be very helpful. So there's a few tools that many physicians will use when they're prescribing antibiotics to restore or help maintain gut health.
Okay, very interesting stuff. Dr. Bogoch, always appreciate your time and insight. Have a great week, and we'll chat again with you next time. Thank you.
Thanks, Jennifer.